We have not the same problems in each country, no? We have different health systems.
Whatever country we're in, healthcare systems are there to protect our people, and fraudsters undermine that protection. Yeah. People rely on us to protect them against those fraudsters.
It's well recognised that corruption has a financial impact on systems, but it also has health impact. It has a major impact on health in the context of people not being able to get health services.
In fact, a good fraud is a fraud that didn't happen, and so we invest a lot on prevention of fraud.
I think in Europe we're sharing many of the same problems and challenges, procurement, for example, conflicts of interest.
Our ambition is to involve providers even more in developing services that make compliance simple and effective.
Institutional coordination is fundamental to building an ethical procurement culture.
And we have different problems and different risks in fraud and corruption. But the European network can put us all the tools and all the policies that are making easier to diagnose and to treat all this fraud and this corruption.
Before, years ago, we tried always to understand the different contexts, and it's so different that it's difficult to understand how it works. Now what we do, also in the monthly webinars, we just try to explain one case of fraud that we have, and quickly we see that there are other things that others say, we have the same problem. So when we talk about a concrete case, it's more easy to find the things that connect us, and even though the context can be completely different.
So we've already onboarded generative AI for our people. We're using that now for report writing and to analyse trends in fraud. It's proving to be incredibly useful. I think there are some tremendous opportunities for us to create, for example, learning for investigators, for media reports, for intelligence reports. We see a lot of opportunity. That opportunity also exists in the detection of fraud. Currently, we're investing in machine learning, a subset of AI, to detect patterns in behavior.
To us, AI is part of the future, but it's not yet a magical wand or a magical tool that will erase or impeach all fraud to be committed. What is important to say is also that AI is used by fraudsters to use its identity to forge documents, and so it's important that we counter-use AI against us.
Sometimes the work of the enforcement community isn't necessarily taken into account and then used as a feedback loop for changing and improving the system. So I think there's more to be done to bring together the people working on enforcement and the people working on system design, so the lessons that we can learn from the enforcement community are then reused and utilised in future systems.
Compliance works best when providers understand our measures and feel included in shaping them. To achieve this, we actively communicate what we do and why. We provide clear guidance, both targeted and general, and make support available on demand. Transparency is key.
We have a document called the Risk Map on Public Procurement that analyzes all the risks in public procurement, but in general, analyzing it like in cross-cutting risks and risks related to the 3 phases of a contract. And we also, by law, we have to prepare a report, annual supervision report. And in one of the chapters, chapter 4, we analyze all the information related with fraud and corruption, with the data that the anti-fraud bodies give us.
It's very important to assume the fraud when it happens, and the cost of it, and the way to tackle it next time, and to always am better.
I agree. It's a learning circle. You risk assess, you put in place mitigations, you assess whether they're working or not.
Exactly.
And then you adapt the mitigations to improve the controls. I agree.
Yeah.
We have old people who want long life. We have young people that need to actually enjoy those lives. We have all of that, and it's really important that we join together and protect healthcare systems so they can protect the people who rely on us.